podcast. Thank you so much for joining me. I am so glad you are able to join me today. Today, I would like to talk a little bit about how your physician, my physician, how physicians in general go about diagnosing Alzheimer's disease. Like the way I said, it takes about, before the disease manifests itself, it could take anywhere between 15 to 20 years. And there are different ways of establishing the disease, and there are different scales that physicians use, neurologists use, geriatricians use, psychiatrists use. The scale that I prefer and I like very much is a scale that was developed by Dr. Barry Reisberg. It's called the FAST scale. The reason I like that scale is it's a very functional scale. As an occupational therapist, when I look at my client, when I look at an individual, when I look at my patients, what I look at is what is it they can do and what they cannot do. I'm always looking at their functions. When I say functions, what I mean by functions is activities of daily living. Activities of daily living includes feeding, grooming, oral hygiene, dressing, bathing, ambulation. It's anything and everything that we do on a daily basis as part of our daily routine after we get up from bed, before we go about our day-to-day activities. And the FAST scale uses these functions. What it does is it uses ADL functions and basic cognitive functions to establish the disease. And one of the nice things about the FAST scale is it breaks the disease into 7 stages. And those 7 stages are purely based on or looks at an individual, their ability to perform their ADL functions and their basic cognitive functions. So essentially, as the individual progresses from one stage to another, their ability to perform their ADL functions, dressing, bathing, brushing, combing their hair, applying their makeup, things like that, their ability to do those things. As an individual goes through the stages, they lose those functions, okay? So that's how a good clinician establishes, diagnoses, and stages the disease. When do we know for sure that so-and-so had Alzheimer's disease? The literature out there points out that the only way we know that so-and-so had Alzheimer's disease is after the death of the individual, and we do a postmortem of the brain and analyze the brain. One of the things that is widely believed that could contribute to Alzheimer's is formation of amyloid plaques in our brain. But again, I've also seen literature where they talk about just because you have plaques, it doesn't mean that you would have the signs and symptoms. Folks, it's very interesting. It's very important for us to understand this. Just because one has the plaques in their brain, it doesn't mean they have the signs and symptoms of the disease. But to this day, the amyloid plaques and the neurofibrillary tangles have been the diagnostic criteria, one of the diagnostic criteria for Alzheimer's disease. And when a clinician looks at a client, at an individual clinically, the only way they can stage the disease is, without looking at an X-ray or an MRI scan, is by asking questions to the family members, to the clients, getting to understand and know the client's ability to dress and bathe, brush their teeth, comb their hair, and basic cognitive functions. Folks, there's something I want to make very, very clear is aging. Again, loss of memory is not part of aging. Okay, there is this wide prevalent belief that, well, I'm forgetful because I'm getting old. We all forget things, and that has nothing to do with aging. There are other reasons why we forget things, and the common belief that memory loss is because of my age, or because I'm aging I have this memory loss. It's not normal. It's not usual. Memory loss is not part of aging. I've also seen literature out there that says one of the early signs of the disease setting in is loss of smell. Something for you and me to keep an eye out for. Loss of smell. Again, loss of smell could be due to other reasons also, other medical conditions. And the loss of smell should not be taken very seriously just because one has loss of smell. It doesn't mean, or it doesn't indicate that they have Alzheimer's disease. But the literature does point out that one of the earliest signs of Alzheimer's disease is loss of smell. Just to recap, the clinical diagnosis is established and staged based on a scale called FAST scale developed by Dr. Barry Reisberg. What it sees, what it looks at, what it measures is one's ability to perform their basic activities of daily living and basic cognitive functions. And it's very important for us to understand this. Very, very important. Very, very important for us to understand this. Okay?